As baby boomers enter retirement and more people live into old age, the number of people with dementia will increase rapidly. This population needs support and services to help them remain active in their communities. Lakehead University in Thunder Bay, Ontario conducts innovative research on palliative and end-of-life care. Their findings help caregivers, people living with dementia, and families learn the best ways to cope with dementia.
Lakehead University has one of the widest range of gerontology programs in Canada, both at the undergraduate and the graduate level. We have a lot of innovative programs, many of which are delivered through distance education. For example, we have a dementia studies certificate that can be taken by people anywhere in the world online. And this certificate was designed in conjunction with experts in dementia care. SARA is the Center for Education and Research on Aging and Health, and it is located at Lakehead University on the Thunder Bay campus. It was established in 1992, and the goal of the research is to develop palliative care programs in long-term care homes, studying the process as we go and developing best practices that can be shared with long-term care homes nationally and internationally. Through our research and working with St. Joseph's Care Group in Thunder Bay and the municipality of Halton in southern Ontario, we have 4 study sites.
St. Joseph's Care Group has been around for more than 125 years. Within our long-term care homes, many of our residents have Alzheimer's or other related dementias. And it's very important that we look after the resident from beginning to end. We're currently involved in a very exciting research project around end-of-life care for people with Alzheimer's or related dementia. That's in partnership with our friends at SARA, and it's something that we're excited to be part of.
St. Joseph's Care Group is an excellent partner for this research because they are so community-oriented and so committed to having best practices within their organization, and they see research very much as an opportunity for not only the researchers to benefit, but for the care group, the residents, and the families to benefit.
My mother-in-law, Nellie, was in long-term care for 5 years, and she passed away a year and a half ago. And I've been very interested and involved in the palliative care process since. It really assists families in looking at what the needs of their loved ones are and sharing information, knowledge, so that we can also contribute to the process of death and dying.
Historically, long-term care homes did not provide this kind of end-of-life care, and so it's a new challenge for them to incorporate good holistic end-of-life and palliative care into an environment where they want to really promote quality of life for residents from the minute that they walk in the door.
Because of the research group, we're putting together a palliative team. We will discuss the psychological, spiritual, and pain and symptom management for our resident to make sure that all of their wishes, theirs, their families, everything comes together for their end of life. With the research group, personal support workers have been given a voice in long-term care homes.
By working in this way, the kinds of changes that we're able to make through our project become embedded in the organizational culture and will sustain long into the future after the project ends.
Lakehead University also conducts research into self-management, which helps people in early stages of dementia find ways to live full and active lives.
Self-management is ensuring that people are able to live well with a chronic condition, ensuring that people have the skills, the education, the resources, and the support to live well.
I was diagnosed with Alzheimer's in the year 2000, so I'm into my 11th year at this point. About 3-4 years ago, Elaine gave everybody a camera. What she wanted to know was what we did on a daily basis to get ourselves through the day, shall we say. Well, this one actually represents the start of a typical day. I'm going up to get the mail and
The Photo Voice project really illustrated how Bill and some of the other participants were finding really unique strategies every day to manage some of the things that come along with dementia, such as their memory loss.
If I have a message or something that I have to take, or information comes in over the phone, I immediately write it down on sticky notes. Then I transfer it to a calendar, and I also put it in my BlackBerry. So I am continually prompted.
So it really struck me how we should be taking what they're doing and what they've learned in terms of living well and coping day to day, and translate that and help other people living with early stage dementia to be able to do the same thing.
What I get from this actually is some personal satisfaction in seeing the results and the development of some of the others more than myself. If I can give something back that's going to benefit someone else, that maybe someone will at least come forward and say they've got a problem, that's good enough for me.
From helping people in the early stages of dementia to studying end-of-life care, Lakehead University is making a difference not only in Canada but around the world. Continued research and partnership with groups such as St. Joseph's Care Group will allow caregivers, residents, and their families to become active participants in finding innovative ways to cope with dementia.